Newsmaker. Hey, Matt, good morning.
Hey, good morning to you, Diane. It's not likely to go away for a while, not until something actually gets accomplished. Even then, I'm sure the debate will continue. We're talking health care. And with us this morning from the Coalition to Protect Patients' Rights, Dr. Drake Bellenger. Good to see you this morning, sir.
Nice to meet you.
Actually, you're with the Louisiana Steering Committee. You're one of the members as a part of this coalition. What is y'all's purpose? What are you out there trying to do, trying to get accomplished?
Well, it's a nonpartisan group who's gotten together, and there's a lot of information being put out about the health care reform,
Sure.
The current bill that's being proposed now, and other bills that are out there. And we're trying to make a nonpartisan bouncing board or information place where people could come and we could say, well, I know what this says, I know what this has been said, but this is what we believe as physicians needs to be done.
The head of the coalition, Dr. Palmisano, that's right?
That is correct.
He's actually come out in some of his addresses and said public option is just not something we see as feasible. It's not the right direction to go. Is that the majority opinion you're getting from a lot of the people that you're seeing?
Most of the physicians that you speak to, we go to meetings.
Sure.
And we do converse with other doctors from other countries. So we know what nationalized healthcare system entails and what its strengths and weaknesses are. And we feel that the weaknesses far outweigh the benefits of that system whenever we have what we have here in the United States, and that is the best healthcare system in the world. And if you seek to change that system, you need to just improve on its weaknesses and not dismantle the whole system altogether.
You know, a lot of people say, I mean, the best healthcare in the world, and I am fortunate enough to have healthcare. 50 million Americans do not. There are organizations around the world who rank the United States healthcare system far below the best. I know I have an insurance company in between me and my doctor who does not care about my health. And their prices have done nothing but go. They keep reaching for a ceiling that is apparently not there. So how do we, without a public option, make this private system work for the patients? I mean, the Coalition to Protect Patients' Rights, my wallet is getting beyond bruised.
I think the healthcare providers need to step up. And insurance companies are great at health costs, not at health care.
Sure.
Providers and hospitals are the ones who provide health care.
Right.
And I think that's where we should focus on. I think the strengths of an insurance company is to look at those things that are cost drivers, this, that, and the other, and communicate with the healthcare providers saying, look, we see a trend here. What should we do? Let's sit down and let's decide what's the best way to have good health care, and we handle the health cost.
When we talk about the health care versus health cost, the government and their public option, that would be more of a health cost issue, not a health care issue. Is that right?
It would.
They're not trying to say, I'm going to be your doctor. They're saying we can provide you with an insurance plan, a cost issue. So when people are saying, the government, I don't want them as my health care provider, that would be wrong. It would be health cost.
Correct.
Okay.
And it would impact health cost to a certain extent.
Sure.
But you have to look at it in terms of what they're about. I mean, certainly administrative costs can go down with the government.
The overhead, it's
system.
like 30% of the bill that you and I pay.
Right.
And if the government, I mean, they're obviously dealing with huge numbers, they could reduce that, I would imagine, to some extent, the overhead.
They can, but then you get into a system where, and I think, and I've gotten this from Mr. Levine, who's the Louisiana Department of Health and Hospitals leader, and he looks at problems with our own system, our Medicaid system here in Louisiana.
Yeah.
And he said something I thought was very good, and it summed up a lot, is that the current Medicaid system here are check writers. They just write the check.
Exactly.
And they're doing a very poor job at controlling all the other aspects of healthcare and their health costs. And that's where and he's a big proponent of medical homes, which several of these bills have, and I think that's good.
Yeah.
Those are the good parts of several of the bills that are out there, is that the medical home model, and where you empower the patients and the providers to make decisions on their health care.
This is a huge debate. It's going to continue for a while. I'd love to have you back. If you've got some time, we'd love to continue talking about this, because I guarantee it's not going away. Doctor, good to see you. Thank you so much for your expert opinions.
You're welcome.
It is